Good afternoon. Thank you for the opportunity to present. I have no disclosures. Overall, colorectal cancer incidence and mortality have been decreasing in the U.S. in recent years. By the end of 2022, there will be 151,000 new cases of colorectal cancer diagnosed, with age-stratified data showing increase in the under 50 age group. Despite the lowering of age group from 50 to 45 by the American Cancer Society in 2018, a subset of patients is still being diagnosed with colorectal cancer on inpatient colonoscopy. This is an indicator of patients that are missed at screening and diagnostic evaluation. The purpose of this study was to assess trends and predictors of inpatient colonoscopy yielding colorectal diagnosis over 2 decades, and to assess predictors of surgery on the same admission. This was a retrospective study that utilized the most recent NIS database from 1993 to 2016 to identify adult patients aged 18 to 85 with a diagnosis of colorectal cancer on inpatient colonoscopy. Discharge level weights were used to generate national estimates. Overall, we found that 80,000 patients underwent inpatient colonoscopy for colorectal cancer, with a significant decline from 1993 to 2016. The mean age at inpatient colonoscopy for colorectal cancer has also significantly declined from 69 to 62. Inpatient colonoscopy was found to be increased in those under the age of 45 and in those 45 to 75. In those under the age of 45, inpatient colonoscopy increased by 6%, whereas in those over the age of 75, inpatient colonoscopy decreased by 20%. On multivariate linear regression analysis, the factors that were associated with requiring inpatient colonoscopy with a diagnosis of colorectal cancer in more recent years were those that were non-Caucasian, females, those under the age of 45, those with low income, self-pay or no insurance, those with higher comorbidities, and obese patients. On the same admission as an inpatient colonoscopy, we found that 61% underwent colorectal surgery. Patients were significantly more likely to be of white race, have higher income quartile, and have Medicare or Medicaid. And those aged 45 to 75 were significantly more likely to have same admission surgery. On multivariate regression, when accounting for confounders, we found that female gender, age above 75, private insurance, number of comorbidities, and obesity and metastatic disease remained independently associated with surgery on the same admission. So in conclusion, the rate of admission for inpatient colonoscopy for colorectal cancer is decreasing over time. However, we are failing to screen a specific group of patients: those that are under the age of 45, those of female gender, self-pay or no insurance, obese patients, and those with higher number of comorbidities. The number of the same admission surgery for colorectal cancer is also common in these patients. Thank you.